For miles around, every pharmacy has abandoned Rita Johnson's neighborhood.
On a summer day, I really could walk to the one that wasn't too far from here, and they closed within months of one another.
To find the medication she takes for cancer and a recent spinal surgery, she now makes a winding 5-mile trek on public transportation. Some of her neighbors have neither the patience nor the money to make it. Welcome to the pharmacy desert, the place in major American cities where garbage lies strewn like urban tumbleweeds before what used to be corner drugstores. It's a growing phenomenon in poor minority neighborhoods across the United States.
It seems racially motivated to me because they've all mainly closed in Black and Latino communities.
It is in neighborhoods like these that the U.S. opioid epidemic is at its worst. Addicts suffering opioid overdoses are often left without access to the life-saving drug Narcan. This man survived because these police officers were nearby with a ready dose.
You may have a child that's on asthma. So what if that child does not have a local pharmacy in their area and they can't get that rescue inhaler? So 9 times out of 10, that patient will end up in the emergency room, or the outcomes may be worse.
Chicago's Cook County hospital system has tried to fill the gaps with mail-order pharmacies, but mail-order doesn't provide the counseling, in-store health clinics, flu shots, and other services local drugstores offer. Pharmacy professor Dima Katu says for pharmacies, it's simply a business decision to leave areas where more of their clientele use government insurance.
If an area is not profitable, they just leave, like any other business would. When you think about reimbursement rates for pharmacies with public insurance versus commercial insurance or private insurance, it's much lower.
Cities are increasingly becoming a land of drugstore haves and have-nots. While there are pharmacy deserts on Chicago's poor south and west sides, the affluent north side is a pharmacy oasis with a drugstore on one side, often directly across the street from another. Renita Johnson and her neighbors are left hoping the longer distance they have to travel doesn't mean the difference between life and death. John Hendren, Al Jazeera, Chicago.